The Tim Powers Show. We'll be right back. This is the Tim Powers Show on the VOCM Big Land FM radio network.
Last week in British Columbia, the new Democratic government was sworn in. And something unique happened, or certainly I perceive it to be unique. The new Premier, John Horgan, created a standalone Ministry of Mental Health and Addiction Services. He appointed someone who Newfoundlanders will know, Judy Darcy, the former union leader at the Canadian Union of Public Employees, as the minister for this department. What a challenge she has. She's going to have to pull together programs and clients spread over a half dozen ministries and agencies. Never an easy task. With all the bureaucratic resistance she will encounter. And she also has in British Columbia the immediate challenge of an out-of-control abuse of opioids. In effect, as one columnist described it, she's creating a ministry to manage a crisis in the midst of a crisis. To talk about what this ministry means in terms of the symbolic value and perhaps the real importance to the Canadian mental health movement and to get her overall perspectives on this and more, I'm joined by Dr. Janine Hubbard, who is the president of the Association of Psychology of Newfoundland. How are you, Janine?
I'm well, thank you.
Well, what did you think when you heard the news about this department?
Well, I was really intrigued and certainly very pleased with the idea. Anything at this point that is bringing mental health services to the forefront is obviously going to attract our attention, and I think it certainly reflects the mood of both the province of BC, but I'd also say of the country in terms of increased attention towards mental health needs.
Important to note for listeners, there have been a couple of attempts before. In the early 2000s, BC had a ministry of state for mental health, and Alberta has an associate minister who is responsible for mental health. The difference in both those cases, and both were key gestures, is that they weren't full ministries. A full ministry means that a minister oversees all of what he or she is responsible for, has the power and the resources to act on those things, and reports to nobody else but the Premier and fellow cabinet colleagues. Can you see something like this happening in Newfoundland and Labrador, potentially, Janine?
Well, it's certainly possible, and we have a few inroads. And the other thing that's important to remember with an individual ministry is it also has its own separate budget and financial accountability so that we could actually see where the dollars are being spent towards mental health. We are kind of at a half step towards something similar with the most recent fallout from the All-Party Committee and the next step directions that have come out. Newfoundland and Labrador has proposed a mental health and addictions provincial program executive committee that is being headed up by the Deputy Minister of Health and Community Services. And then it also involves some of the CEOs from the health authorities and the Newfoundland and Labrador Centre for Health Information. So the mandate around implementing all of those 54 mental health recommendations now lies with the Deputy Minister of Health.
And the Deputy Minister, important to point out again, we're getting into the mechanics of government, is the second most senior official in a department. He or she is the one that is usually charged with operationalizing, financing, resourcing the commitments that a government makes in its election campaigns and whatever it says in its throne speeches and budget documents. So it's a senior position, important, no doubt, to be sure. What are some of the challenges that Judy Darcy is going to face? From your perspective, you work still as a clinical psychologist. What is she going to encounter and some of the resistance she's going to face?
Oh, I do not envy her the task ahead of her. As you alluded to, one of the biggest challenges we've always had within mental health is that it covers so many different areas, so many different disciplines. First and foremost, we look at departments of health, education, corrections, community services. There are so many issues that it could potentially cover, that how you tease that out, how you determine what's going to be put in the portfolio, what isn't, is going to be challenging. I do think there is some potential concern in terms of what will be designated mental health. While it's nice to have the increased presence, we also have always been stressing the idea that mental health and physical health are all part and parcel of just health and wellness of Canadians.
Yeah, and some of the frustration I've heard when people get beyond the pleasing of the symbolism of it all is what's going to happen from a definitional perspective, which also means that's code for who's going to get the money to do what.
Exactly.
Most health departments have the resources to deal with whatever their provincial or federal jurisdiction is around preventative health and wellness, and Participation is one program, for example, that's funded by the federal government. Outside of Health Canada, Health Canada gives it a little bit of money, but that's all part of the exercise. What about the people within the broad healthcare sphere? How do you think they're going to react to this? Because again, getting back to money, if there is a realignment happening and they may have to change the way they manage their pot of money, how's that likely to be met?
Again, I think it will really depend on kind of how it sifts down. There are some areas that have been traditionally considered mental health, for example, here in Newfoundland and Labrador, for example, the Waterford, or the mental health and addiction services within the healthcare system. Those would be a fairly easy transfer over into something like a mental health and addictions portfolio. Where it becomes a lot more challenging is, for example, mental health needs within the school system. Yeah. How do you tease that piece out? How does that translate? And that's where the bureaucracy is going to be really interesting to see.
But who would have fathomed this 20 years ago, that in Canada's third largest province, one on the cutting edge of many other democratic issues, that now they have a ministry of mental health and addictions? I mean, that in and of itself to me is just utterly fascinating.
It is fascinating, and it's so overdue. And to me, it speaks to credit for all of the anti-stigma campaigns that have been going on over the last 20 years. And what we've really seen is a shift over the last even 4 or 5 years is the stigma is decreasing. People are out there, they're talking about it. The problem being they're talking about it and they're wanting to access services, and they're finding that services are difficult to get access to or are very expensive.
Let me get you to play Judy Darcy for a minute. We've talked about what her challenges are, but if you were her, what would you, if you were able to head a ministry, maybe you will someday, Janine, what would you want it to do if your ministry was mental health and addiction? How would you outline and go about outlining your priorities?
Well, I think the most exciting thing is that there would be a dedicated voice at the table during those cabinet discussions. Whereas I think for most people, if you're there as the Minister of Health, you're representing physical health, you're representing mental health, and mental health is such a small part of healthcare budgets in most provinces that to have that dedicated voice and be reminding people in those discussions of the prevalence of mental health issues and the importance of them and just how widespread those issues are, that really they impact everyone's portfolios.
People often unfairly, but the healthcare environment is competitive for those very dollars. So it's called the healthcare industry, as the Indigenous world is sometimes called the indigenous industry, because there's a lot of dollars floating around. We've talked a little bit about how the mental health community may react to this. How do you imagine other communities that advocate for relief and healing and the fixing of big profile diseases that afflict many, many Canadians will respond to this?
It's a struggle in terms of the number of dollars is limited, and we are well aware of that. It is really tricky. If you're there representing the Cancer Society, if you're there representing other major illness groups, you certainly would be fearful in terms of loss of dollars. The counteracting piece that I would say is twofold. Mental health has been the abandoned orphan child for many, many, many years. And what we also know is that if you can address mental health issues early with appropriate interventions, you can prevent many of the long-term health costs that become associated with it. You can treat and prevent chronic disease. You can get in early so that we're not having to accrue some of those other far more costlier expenses to the healthcare system.
Just before I let you go, love your observation on this, because we've talked about British Columbia today. We've seen federally, the previous government, the Harper government, invest significant resources that hadn't been invested before in things like the Mental Health Commission. We've seen our Prime Minister talk about a national mental health strategy. Do you think in large measure the politics of mental health has improved and is getting the attention it deserves because it is a much more open and understood set of illnesses among millennial voters who both the federal Liberals and the British Columbia New Democrats are very well connected to?
I would say it's both better understood, although there's a long way to go, but I would say it's far more, we have a generation in terms of those millennials who are much more open about all aspects of their lives, including their mental and their physical health. And I think that has gone a long way in terms of helping to increase that discussion.
Well, great to have you on to talk about this. I'm sure, like me, you will be watching across the country to see if more of these ministries pop up and how effective they actually turn out to be, because they're created. Now getting them operational and having effect is something we all want to see. Dr. Janine Hubbard, Association of Psychology, Newfoundland, thank you for joining us today.
Thank you so much.